intake form just filled itself, and your time at the doctor's office has just been slashed in half. Welcome to Healthcare That Runs Smarter. This is On Call, Off Script, a Jackson Health System podcast. I'm your host, Ruelle Champion, and we are talking all things artificial intelligence, especially how it speeds up the boring parts of healthcare. Joining us today is George Rosello. He's the tech maven behind automation at Jackson. George, thank you. Tell us more about your role.
Thanks. It's great to be here. So my role kind of oversees pretty much everything data-driven within Jackson Health System. So from teams that do data engineering all the way to data science, integrating data and trying to make it more accessible and more useful.
Now, that is a perfect way to set the scene for us, George. How are we working to make things smarter and not harder for our people?
Yeah, so I think one of the biggest challenges in healthcare is that it's a very unstructured place. So when we think about data, we think about things that are filled out on forms that are easy to read. But a lot of the data in healthcare is unstructured. It's conversations, it's documentation, it's transcriptions from physicians. So really only about 20% of it is useful, and the other 80% is really difficult to get. And it's really hard to create as well. Those physicians spend a lot of time doing documentation, a lot of time reading things. So anything we can do to speed that up and make that more accessible is going to be a huge benefit to the patient care journey. So one of those things is leveraging AI. The last few years, we've seen huge leaps in what AI can do. And most notably being able to tackle this unstructured problem of how do I get access to this data that reads like a story instead of, really select data points. So by being able to leverage AI tools, we can now not only draft documents for providers, but also read documents that providers have already done in the past. We can take years of medical information and extract meaningful information from it and make that accessible to a physician in your most current visit. Right. So we're taking what used to be a really tedious process that would happen after hours or before a patient showed up to now being able to happen in real time and something that's very easy to do and anyone can do.
Now that sounds like it's saving tons of time, right? So what does that translate to for the patient, right? The patient, they go into an appointment, they're not thinking about who's reading what chart or who's taking what notes. Have we been able to pinpoint, okay, this is knocking down 30 minutes, this is knocking down an hour? How much time are we really saving?
Yeah, so the average visit might construe of, let's take an outpatient visit, some of the simplest ways that a patient may come in just to check for their PCP or do a follow-up. These visits might be 15, 30 minutes of time in an office, but the amount of documentation produced for that can be several pages. Some of it may happen immediately after the visit, some of it may happen days later. So these types of visits are very common and produce a lot of data that is otherwise very difficult to use. So by being able to leverage AI, we can hopefully shorten that time frame down, make sure it's accurate at the time the patient's in the visit. When they leave, they have a copy of it as well. So they have everything that they know they went through and everything that was either done to them if it was a procedure or if it was a visit that gave them some advice or how to change certain things to help with a better health outcome. They'll have all that information accessible to them right away. So it's saving time for providers. On the patient side, where we see a lot of time saved is the build up to the appointment, right? We've all been in that situation where you get an appointment and you have to register and it's, filling out the entire history of your life in a form and then repeating yourself 2 or 3 times after you get there. Some of that is to make sure that it's accurate and give you an opportunity to correct a mistake if you forgot something. But a lot of times it just happens because it needs to be captured by multiple systems, right? Or different people need to read it. So if we're able to create a better flow of that information and data throughout the health system, from the patient to the registrar, to the nurse, to the doctor, we're allowing that data to kind of travel with you more successfully. And by doing that, we're not just saving you time, but we're creating a more accurate visit where all that information is available and it stays with you for your next visit, for a hospital stay, years later when maybe you haven't had a visit for years and you come back in. All that information carries forward. So the more accessible we can make it and the more digestible for clinicians, then the easier and the more it can serve you.
Now, this sounds like one tool that's doing it all, or is it multiple AI tools that are working hand in hand to do this process? Is it patients can use voice recognition software and tools? Do our providers use that as well?
Yeah, so it's a combination of a lot of tools that accomplish this. So we do have a lot of voice recognition that exists today. You see this with physicians that do transcription. So like radiology, it's a really popular space. You'll also see this for like surgical operative notes. So someone having a surgery, A lot of that information is also captured verbally. But what's not captured is the conversation between patients and physicians, right? So you come into a physician office, you sit down to review the results of maybe a procedure or a test. That's a conversation, same as what you and I are having right now.
Absolutely.
No one's recording that, right? Nothing's being written down, nothing's being copied. There'll be some notes that you'll be given afterwards, which is the physician's interpretation, and then you'll have your interpretation. And I think one of the biggest takeaways that we see around this space when it comes to a patient receiving information this way is on the drive home. Right. So let's say you have somebody come in and one of their kids is with them, right? Maybe it's an elderly parent. They bring their younger son or daughter with them. On the drive home, what happens? They say, well, the doctor said I should do A, B, and C. And then the child says, well, hold on. I actually heard you should be doing it a little bit differently, right? And it creates this little space where misinterpretation can happen, right? The discharge documentation might have the specific steps they have to take, a medicine, a prescription, maybe some advice in terms of, getting more exercise, but the key takeaways that happened in that conversation aren't captured. So by being able to create some ambient AI tools that can listen and provide that agency for both the patient and the provider, capturing an accurate retelling of that conversation, that's really the next step in being able to capture that visit and make it tangible for that patient so that when they take it home, there's not a debate about what happened. It's able to, see a transcription and know exactly what was said.
Yeah.
And now there's better care delivery for the patient because they're able to recite that information exactly the way it was said.
Absolutely. Well, accuracy is one thing, but patient safety and their information is another. How are we staying HIPAA compliant with AI tools? What are some things that a patient would want to know or need to know about the safety of their information?
Well, keeping information safe is a big priority, and all these AI tools that we see coming out that everyone has on their phones, on their tablets, becoming more and more accessible. A lot of that information does not reside in the health system. It goes off into a cloud. It goes into an infrastructure owned by a different company that has nothing to do with healthcare. So there's a big conversation around how do we keep this safe. The other part of it too is how do we track the accuracy of this information? Everyone's heard about hallucinations when an AI gets confused and gives you the wrong answer to something, but thinks it's the right answer. One thing that the AI will always respond with is confidence, right? It will always sound like it knows what it's talking about. So it's up to us to be able to fact check that. So when it comes to keeping patient information safe, all the AI stuff that we do at Jackson stays within the walls of Jackson. So anytime we're using any kind of cloud service, it's always separated from that infrastructure and something that we are doing only within our account. So it's something that we're able to keep safe, keep within the walls of Jackson, keep patient information safe. But we're able to build on that through our data science teams, our data engineering teams, business intelligence, and be able to build on the knowledge we're gathering from that to create more accuracy, better tools, but not sharing anyone's data with outside agencies.
Absolutely. Now let's switch back over to the employee experience. I'm just picturing myself as a nurse and I'm putting in information for a patient who I'm seeing in their chart. One thing that I can imagine is overwhelming is being a doctor looking at that chart, not knowing what to look for precisely or what should stand out the most. Are there any tools that we're using that can give that receiving provider like, hey, you need to look at this first, look at these vitals or look at this information first before other pop-ups?
Yeah, I mean, there's a combination of tools that we use to accomplish that. So the electronic medical records have a lot of rules built in that will help prompt when something is very discrete, right? If a lab value is too high or if a numeric value isn't where it should be. But what becomes complicated is when a series of conversations or documentation track data points that aren't necessarily associated to themselves, right? So maybe I complained to my primary care about one ailment, then I went to a specialist and complained about a different ailment. But if I combine those two things, it creates a higher concern. Yeah. And that's where we see the advent of AI being helpful, where it can look through all this really dense information. It can gather it together and it stays persistent and constant. Every time you go to a new doctor, you have to retell your story. What's been your patient journey? What's the history of your healthcare?
It makes you almost wonder why you even say it in the first place if you have to sound like a broken record.
Yeah. It's a big challenging space, and every time you recite that history, it tends to get shorter, right? Because we're not going to go through years and years of the past. We're going to say what we think is relevant, but everything is relevant, especially when we're dealing with so much data that persists across our entire lives. So leveraging tools like AI allows us to make sure that conversation stays persistent, right? Every time I go see a doctor, if I'm using the same technology solution, I should be able to continue that conversation where it left off. And if I, as a provider, miss something or there was too much information for me to be able to check ahead of time or know where to look,
Right.
the AI can push that forward and say, hey, this seems relevant. You should take a look at this. So these kinds of tools are in development, and you see them across different vendors at different spaces. We're working on our own within Jackson to try and really use AI as a way to point people to the most important information at the time that they need it. And make sure that that rises to the top so that people spend less time searching and less time missing information that they should be finding.
That was going to be my next question, George, is what are we doing here? What's going to start here at Jackson? What are we rolling out? What's the rollout plan even look like for you?
Yeah, so we have a few different vectors that we want to bring in. So one thing that we're launching, which we're really excited about, is the digital workforce. So this is really leveraging a combination of AI and automation to be able to create digital workers in different departments and spaces that can help out. So one of them, is to help with documentation, right? It's where we may have a lot of different notes that exist for a patient. Maybe it's a long hospital stay and they've had a lot of different procedures and they've spoken to a lot of different doctors and clinicians. And it's hard to put all that together into one concise note. So being able to leverage AI to facilitate those conversations, document that, and draft those things for physicians can save a lot of time. In other spaces, we're leveraging in scheduling to be able to help with it's very tedious to schedule medical procedures. Some things are easy. You want to just come in and see a doctor for an ailment, no problem. But other things can be really complex and have a lot of steps.
Yes.
And it can be very confusing for patients. What steps I need to do? How far have I completed that process? So this allows us to really help facilitate that conversation a little bit better, identify things that are missing, be able to predict if a patient might no-show because they're not further ahead in the process than they should be, especially based on when their appointment date is, and being able to manage schedules a little bit more efficiently. The last place is tedious work. So this is where you have to blend a careful line, because anytime you're bringing in AI, especially today with the conversation we see, in the media and on social media, is, AI is coming for our jobs, right? And it's not really coming for your jobs. The people who know how to use AI are the ones coming for those jobs. So we need to make sure our workforce knows how to interact with AI and use it effectively. And that means looking at jobs and identifying tedious tasks that are things that an AI could do very safely and consistently, but we as humans maybe don't like to do.
Right.
And we can take that and automate it. And then when we automate that, that frees that worker up to do things that they actually need to do, which is that human experience that healthcare is most known for. So by freeing that up, we're able to repackage these jobs and really focus people on that human element, and take away that stuff that distracts from that and really use AI to do that, which thankfully it never gets bored. It doesn't get distracted by Facebook. It stays.
It's going to stay on task.
It stays on task. It doesn't ask for time off. So it's a great candidate for that.
For sure, but nothing beats human interaction sometimes. So
no, definitely not.
George, when we're workshopping these new tools, these new projects that we want to use to bring Jackson into the future, what's the feedback been like so far? Do you have work groups that you're working within your own department, or are we working multidisciplinary across other sectors within Jackson to get feedback? What's it been like? Yeah,
it's absolutely a multidisciplinary effort. I think one of the challenges, and this goes even just beyond just AI, but just what IT at healthcare looks like in general. For a long time, it's been a service-driven industry where, we're providing service, we're responding to needs. But now it's more about partnership. It's more about identifying what departments do, what do they function, what are the things that they deem a success, how do they measure their success? Yeah. And then crafting teams that really work towards that success with that department, taking on that mission as if it's their own. It used to be years ago in IT, if you went live with something, you launched a new application, you installed some new technology, the installation itself was a success. That's not the case today. We really want to see the adoption. We want to see the end users embrace and use it successfully. And we want to see the mission statement of that department, whether it's healthier patients or on-time schedules or a more efficient practice. We want to see those goals be achieved. And until those goals are achieved, we don't consider our work done. So that level of partnership is working side by side with departments, not working in a black box of IT and then eventually bringing it in, but working with them hand in hand. And that also gives them an ownership stake in what we produce, right? They feel it's part of what they crafted, what they constructed.
Right.
It's like if you were getting a house built, you may not be the architect, you may not be the contractor, but when you look at that house and you live in and you move in, and at the end of the day, that feels like your house because you were a part of the process. So that's really what we try to achieve at Jackson, is work with our partners in these different clinical departments and make sure that they feel like they own the house.
Right. So it sounds like every department should be familiar with their IT representative and maybe want to get close with them as we start to integrate these new tools.
Yeah, absolutely.
Now, George, here's your tough question and our final question. So if you limitless budget, no obstacles, you can install a new AI tool that will help patients, doctors, nurses, everybody in between starting tomorrow. What would it be? What would you do?
Oh, wow. And I think that goes back to one of the earlier points in the conversation. I think the biggest thing that we could do is to take that 80% of data that is still kind of the unknown of healthcare and find a way to make it manageable, which I think for the first time ever using AI, we're able to do. We talk about, what's left to discover as a human race. We think of space, we think of the ocean, but our bodies are also a mystery. There's still so many things we don't know how to heal, so many things we don't know how to discover. And when you look at everything we've done in healthcare for the last 20, 30 years when computers have been introduced, we've accelerated so quickly.
Yeah.
And that's been only using 20% of the data that's available. So if we could snap our fingers and unlock the other 80%, imagine how much we could do. Imagine what we could accomplish with the whole 100% of data at our fingertips. We would accelerate healthcare at a pace we've never seen before.
Right.
By the time you and I are at retirement age, we would look back on healthcare and it would look like it jumped forward 300 years.
Wow. So let's make a date. 20 years, we'll meet back here and see how far we've come with AI in healthcare, George.
All right, that sounds good.
I appreciate you. Thank you, George, for joining us here today. So it sounds like our takeaway is if the task is repetitive, just automate it. AI is only as intelligent as the humans behind it. Thank you for joining us on Call Off Script. Make sure to stay tuned in with our social media accounts and keep watch for our next episode.